Tinnitus is the hearing of sound when no external sound is present. While often described as a ringing, it may also sound like a clicking, hiss or roaring. Rarely, unclear voices or music are heard. The sound may be soft or loud, low-pitched or high-pitched and appear to be coming from one ear or both. Most of the time, it comes on gradually. In some people, the sound causes depression or anxiety and can interfere with concentration. Tinnitus is not a disease but a symptom that can result from a number of underlying causes. One of the most common causes is noise-induced hearing loss. Other causes include ear infections, disease of the heart or blood vessels, Meniere's disease, brain tumors, emotional stress, exposure to certain medications, a previous head injury, and earwax. It is more common in those with depression. The diagnosis of tinnitus is usually based on the person's description. A number of questionnaires exist that may help to assess how much tinnitus is interfering with a person's life. The diagnosis is commonly supported by an audiogram and a neurological examination. If certain problems are found, medical imaging, such as with MRI, may be performed. Other tests are suitable when tinnitus occurs with the same rhythm as the heartbeat. Rarely, the sound may be heard by someone else using a stethoscope, in which case it is known as objective tinnitus. Spontaneous otoacoustic emissions, which are sounds produced normally by the inner ear, may also occasionally result in tinnitus. Prevention involves avoiding loud noise. If there is an underlying cause, treating it may lead to improvements. Otherwise, typically, management involves talk therapy. Sound generators or hearing aids may help some. As of 2013, there were no effective medications. It is common, affecting about 10 to 15% of people. Most, however, tolerate it well, and it is a significant problem in only 1 to 2% of people. The word tinnitus is from the Latin tinere, which means to ring. Signs and symptoms. Tinnitus can be perceived in one or both ears or in the head. It is the description of a noise inside a person's head in the absence of auditory stimulation. The noise can be described in many different ways. It is usually described as a ringing noise, but, in some patients, it takes the form of a high-pitched whining, electric buzzing, hissing, humming, tinging or whistling sound, or as ticking, clicking, roaring, crickets or tree frogs or locusts, cicadas, tunes, songs, beeping, sizzling, sounds that slightly resemble human voices, or even a pure steady tone like that heard during a hearing test. It has also been described as a whooshing sound because of acute muscle spasms, as of wind or waves. Tinnitus can be intermittent or continuous. In the latter case, it can be the cause of great distress. In some individuals, the intensity can be changed by shoulder, head, tongue, jaw or eye movements. Most people with tinnitus have some degree of hearing loss. The sound perceived may range from a quiet background noise to one that can be heard even over loud external sounds. The specific type of tinnitus, called pulsatil tinnitus, is characterized by hearing the sounds of one's own pulse or muscle contractions, which is typically a result of sounds that have been created by the movement of muscles near to one's ear, or the sounds are related to blood flow of the neck or face. Medicine by Alexandros G. Sfakianakis, Anapaphysios 5 Agios Nikolaos 72100 Crete, Greece, 003069326071740 003028410261882, alsfakia@gmail.com.